Hello, everyone. You're welcome back again to IJ Splendid YouTube channel. In today's episode, I'm going to continue on highlighting some side effects of chemotherapy on cancer patients. But in today's episode will be basically on what happened to me. Some of them I've already said them on the previous episode. So one of it is vein burn. Seeing that I'm on a big size, I have this tiny vein. So the doctor will use infant cannula on me. So because of this infant cannula, it will cause friction on the wall of the vein, resulting to this vein burn. This vein burn, I'll begin to experience it after a week of chemotherapy. It will start with itching on the site. From there, the whole place turns dark, just the way you're seeing on this picture. It turns dark and looks like a fire burn. It looks or hot water burn. It will just look like that. So, and I will use zinc oxide cream on it. It will clear with time, but it takes a longer time for it to disappear from my skin. Now, I'm through with chemotherapy for more than um, 4 months now, but those areas where I had the chemo are all still dark till now. But the truth is that they are clearing off it, so it's not as dark as the way it were before. Then again, the second thing I experienced was DVT, which is deep vein thrombosis. From my third chemo, I had this pain on my calf. So naturally, I can endure pain. So I thought it's just pain and I will just massage it. But I noticed that the more I massage, the more the pain. So after the fourth chemo, the pain was still there. In short, it was severe. I was still enduring it, but knowing what I was going through, my younger sister had to call my doctor friend who told me that I should go for a Doppler scan. And and the way she sounded on phone is like be fast about it because this is like blood clotting. When it gets to the heart, it will result to death. When it gets to the brain, it will result to stroke. Wow. With speed, I had to go to the hospital. So, and when I went through the scan and it was true, in short, it was the right part of my leg it was because my legs from the calf down to the toes were swollen. So I was placed on Clexane to be taking it every 12 hours. So I took this Clexane for 2 months, and that period, the Nigerian medical doctors were on strike. So I was waiting for them to call off the strike so that I can go for the surgery. So at that point, I was still going on this treatment on my legs, and with time it began to calm down. The legs came back to its normal size, the pains disappeared. So these were things something I went through. So before the surgery I was already okay on that. Then after the surgery I went back to chemotherapy again. I did the fifth, sixth, seventh, and eighth. At this point, yes, I was already used to the side effects I experienced, but somehow it changed. So I said this point, I was experiencing more. I think from the sixth and the seventh chemo, it was now more on burning sensation that I don't know how. I can't explain. I'm not feeling hot physically, but inside of me is burning as if there's fire inside. So I have to use ice block. I take ice block just to help. I take cold water. I drink cold water. I use cold water to bathe, to cool this burning sensation. It came to a point that I became restless. I was having a lot of sleepless nights. I could not sleep because of this. And I was so uncomfortable about it. But glory be to God, with time it disappeared and I became okay. I became diabetic at the course of chemo. Why? Because I took overdose. So because of it, it's like increased sugar level in my blood, resulting to diabetes. So this diabetes, thank God, it wasn't as yes, it was bad at the beginning. It was bad at the beginning. But with diet and, I wasn't placed on drugs because I didn't have diabetes, as I didn't inherit diabetes. So it's something that they knew that it came as a result of maybe the situation I was at that point. So I was just told to work more on my diet, and indeed I did. So I worked more on my diet, which really helped out. So, and now I am no longer diabetic. My sugar blood has come back to normal. And these were the experiences I went through that I don't know if it could happen to some other person, but I'm sharing it because in case if such things occur, so that you will know the next step to take, you don't need to be afraid of it. It's something that you can still come out of it. Just have this faith that is a temporal thing and that will go away with time. All right. In case if you're joining us for the first time, you're free to subscribe, share, and I want to get more questions, and I'm always here to answer them. All right. Thank you, and I will stop here today.